Assalamu alaikum. This is Dr. Hussein Bushkolachi YouTube channel, and we are discussing the uh, awareness of dengue fever, which is nowadays a problem in Pakistan and world over. So let us go to the next slide uh, that will be shared with you. And I hope everything goes very well. So, uh, this is a second slide, and hopefully, it will be covered. Uh, so, at the end of this, uh, you will find that, let us, yes, at the end of the slide, you will know that. The dengue vaccine, dengue situation in Hyderabad, what is environmental situation, and so on and so forth. And lastly, the ISRA University and District Health Department efforts for dengue control. Coming to the next slide, you can see that this is a map of the world, and we are just uh, discussing that the red color is showing that dengue is common, and you can see that the north is little bit are the cooler countries or cold countries. They have less, and as you move to the warmer countries, tropical countries, then this problem is more. So in the background, if you see that dengue vector is a viral disease caused by a virus, which is flaviviridae, and the Aedes aegypti and Aedes albopictus are the two mosquitoes which are the vectors for this disease, and this is in the urban and semi-urban settings more. Uh, then coming to the next slide, and the you can see the history, and ultimately you can see that this is a complication or a symptoms where the bleeding starts from various parts, especially nose, eyes, mouth, and from the skin. Then coming to uh, the history goes dengue virus 265 to 420 AD from China, and in the 18th century, shipping as well as other things started, trade started, and movement in the world started because of the steam engine and many other inventions. The virus was isolated, and dengue was. So there are approximately 100 to 400 million people affected every year around the world. Then coming to the symptoms, this is another situation of the bleeding from the nose, and it is a child picture. This is from Hyderabad recently, dengue patient which succumbed to the dengue infection. Uh, then the virus was first isolated by Ren Kimura in 1943 in Japan in Nagasaki. And you can see that the number in 2024 in Pakistan was confirmed cases was more than 20,000. So coming to the uh, disease, there are clinical pictures as well as epidemiological efforts in which you can identify the cluster of the patients, cluster of the cities where the cases are more, and put your efforts more in that situation. So, any person with acute febrile illness of more than 2 days and less than 10 days with two or more manifestations from severe headache, myalgia, arthalgia, retroburger pain, severe muscular pain, severe backache or joint pain, platelets less than 150,000 per cubic millimeter, and hemorrhagic signs. So, any two signs will make the dengue easy to be labeled as a probable case of the dengue. This is a dragonfly which can kill the mosquito as well as it is a predator, and you can see that how mosquito is eaten, and in a day it can kill about 100 mosquitoes. So this is a good preventive insect. Uh, then the virus was isolated in 1943, and Kimura, I have already told, and some other scientists also discovered same in 1947. So coming to the life cycle of the vector, you can see that how mosquito bites and how it goes to the blood cells and ultimately causes the bleeding and various complications we call dengue hemorrhagic fever and dengue shock syndrome. So you can see that the blue line is showing the rain, and the red line is showing, once again, you can see that the blue line is the rain and red line is the dengue. So as the rain moves up or becomes more and more, the dengue cases also. So in the rainy season, post rainy season, dengue is more when temperature is 27 and 30 or 29 and the humidity is 60%. It is a very favorable condition for the dengue. So this is alert which shows that the third most common problem is the dengue in Pakistan. This is a Wolbachia bacteria which makes uh, these mosquitoes, dengue mosquitoes, ineffective to reproduce, or their coupling processes disturb, genetic processes disturb, and even their life is shortened. So nowadays, Wolbachia mosquitoes infected are carrying are left into the cities and the dengue areas, and ultimately the population of the vector is reduced, dengue is reduced. So this is one in Brazil. There is a huge factory producing such kind of Wolbachia bacteria laden mosquitoes. So these are the vaccines, and dengue vaxia, it has 3 doses, zero after 3 months and after 12 months. And the confirmed cases are given this kind of vaccine because it has four viruses: dengue 1, dengue 2, dengue 3, dengue 4. So this can be a protective against, and it is FDA approved. This is Q Denga, and this is a 2 dose and 4 years and above. Uh, and one dose is given and a second dose is given after 3 months. So there is no need of confirmation of these cases. This is a Pakistan. Here you can see the red spot showing the KPK and the Sindh. They are affected the more. Punjab is little bit better. Then this is one of the famous actress, Bukhari, suffered from dengue in Lahore. The other factors are also the high mobility, low knowledge of the community. That's why we are giving this awareness talk, and climate change, and especially post monsoon surge in cases which now we are facing. Then coming to the prevention side and curative side, because clinical and curative, the mosquito net is a prevention, while the treatment side is a curative management in which blood pressure and continuous monitoring, even the platelets counts, fever, these are managed. There is no particular cure, but symptomatic care, especially dehydration, nutrition, and symptomatic treatment, reducing the fever and pain. It is also called um, bone break fever because it causes a very deep kind and very cruciating pain in the joints and bones. This is another area where we can have public health and other surveillance uh, in which clusters are there, I have already told, and symptoms are there. Then coming to the screening of the windows, home isolation of the patients with mild illness, visit to hospital in case of development of danger sign, and sleeping needs and personal protection, full clothes. These are the mosquito repellent plants, particularly citronella, the neem tree, and Rat Jirani or night queen is one of the famous mosquito repellent, but there are many other. In my research, almost 60 plants are there. Yes, this is a kind of risk communication that complications should not occur, and brochures, pamphlet, health awareness session just like this is important in improving community participation and mobilization for mosquito control activities. This is Arat Jirani or night queen, which is mosquito repellent. This is another that hospital preparedness should be important, beds, isolation wards, and ensure adequate supplies of dengue management, as well as bed nets and indoor residual spray, and refresher training of concerned healthcare will help, especially to reduce the workload and to provide better care. This is once again Queen Night or Rat Girani. This is a neem tree. You can see that this is a very good mosquito repellent, as well as it has many other benefits, health benefits. This is again the dragon killing the mosquito. These are the fishes, particularly goldfish, a very beautiful fish, but it eats larvae in the water. And these are the plants which are mosquito repellents. Thank you very much. I think if this video is liked by you and my channel has given you awareness about the uh, dengue, I think that will be beneficial not only for the students but for the doctors, GPs, even the general public. And we are happy that tomorrow in Isra University, the awareness session will be addressed by two international speakers, Dr. Ayaz Samdani, who has already sent a video, and Dr. Haider Ali Talpur from London and Ayaz from USA. Thank you very much. Thank you very much.